2024. For the next session, we will feature online presentations from our panel of speakers from overseas and will be facilitated in this afternoon by Dr. Gogilan Sevaratnam, Chair, a Scientific Committee on Occupational Medicine, ESCOM, ICO, and Vice President for Malaysian Society of Occupational Health, Dr. MSOHD. Ladies and gentlemen, for information, especially OIK and SHO, please fill out and submit the pre and post program questionnaire for this afternoon sessions to qualify for participants' certificates. Without further delay, I invite Dr. Gogilan Sevaratnam to be the host for this afternoon sharing session. With all due respects, the Assembly invites.
Thank you, MC. Yeah, thank you very much. Hi, everybody. Very good afternoon. I'm Dr. Gogilan Sevaratnam, your webinar chairperson, bringing this live from Sungai Buloh, Selangor, Malaysia. Welcome to the International Occupational Safety and Health Day 2024, with the theme Shielding Future Health and Uniting Against Occupational Diseases. The objective of this webinar is to empower all those who are dealing with safety and health at workplace with occupational safety and health insights and resources essential for the safety, health and welfare of the employees. By comprehensively addressing some important workplace-related illnesses with identification, assessment and management of these cases, attendees will gain valuable knowledge and tools to enhance their ability to protect the health and well-being of workers. This webinar is brought to you by the University Technology Mara, Department of Occupational Safety and Health, DOSH Malaysia, and Scientific Committee on Occupational Medicine, SCOM, ICO. Dear participants, our presentation session today will focus on three important topics. The first presentation is on dusty work leads to dirty lung, which will be then followed by occupational health for construction workers, challenges and management. The third presentation will be on occupational stress, how to deal with it. I'm honored to have a group of esteemed experts from Zimbabwe, Indonesia, and India. I'll be introducing each one of them at the appropriate time during the webinar. Dear audience, please take part in the discussion. At any time during the webinar, please be free to ask a question via the Q&A chat box. Also, please be free to fill up the pre-questionnaire form for this webinar. Respected participants, let's go to the core of today's event. Our first presentation is by Dr. Tongai Mukwewa. Dr. Tongai completed his medical education at University of Zimbabwe, then did his master's in occupational medicine at University of Natal in South Africa, and started occupational health work for 26 years. Dr. Tongai has been the corporate medical officer for a leading sugarcane grower, miller, and retailer. It's very sweet. The company has more than 25,000 workers. He is also an active steering committee member for SCOM and Zimbabwe Society of Occupational Medicine. He'll be presenting on dusty work leads to dirty lungs. As we are aware, dust is one of the main hazards in many workplaces, and they can cause damage to the respiratory system. Let's hear more about this from Dr. Tongai. Dr. Tongai, please welcome, and the screen is yours.
Good morning, colleagues. Thank you very much, Gogilan, for that. And yeah, it is. I'm very honored to be able to present before sort of this illustrious audience. Please allow me to share my screen so that we can get straight into our presentation. Gogi, please let me know when you can see my screen. It's up?
Yep, it's up.
Okay, great. So as Dr. Gogilan said, the talk for today is the how dusty work can lead to dirty lungs. We've kind of simplified things a bit. When we talk dirty lungs, allow me to equate that to occupational lung disease. So, yeah, the presentation format, I'll go through some of the introduction, the definition, and take you through a bit of, sort of where we come from when we're talking occupational lung disease or dirty lungs for the purposes of this presentation. And we'll also do a slight revision on anatomy, not delving right into complicated anatomy, but just that we understand the basis of causation of dirty lungs. We'll also talk a bit about classification of the various lung diseases, and then we're going to touch on, sort of the key occupational lung diseases that you will encounter and which are very topical at the moment. We'll go through diagnostic principles, treatment approaches, and then the prevention of dirty lungs. So straight into it. I'm sure most of you are aware that right now, occupational lung disease are accounting for more than 10% of all lung diseases at the moment. And what do we mean by occupational lung disease? It's a lung condition that's been caused or made worse by exposure to certain irritants in the workplace. There are numerous occupational and non-occupational risk factors that usually interact to produce the occupational lung disease. Why is it such an issue? many occupational lung disease are indistinguishable from those in the general, from lung diseases in the general population. And it's often not recognized as being caused by occupational exposures. Often there's misdiagnosis, or shall we say underdiagnosis, and that's largely because there are inadequate occupational health surveillance programs out there. And how often in medicine do we come across that term idiopathic? That really basically says that we don't know what's caused this. So for us, one of the key things is that the co-founding effects between, sort of the various exposures does really make occupational lung disease very difficult. I'll give an example of a miner. There's been studies that show that in mining, when you smoke as well, there's a higher rates of severe chronic obstructive pulmonary disease in smokers than in non-smokers. And sometimes the effects are environmental as well and may involve large segments of the population and the non-working population. For example, both environmental and occupational exposures to asbestos is a relevant occupational health, or rather health issue in Turkey, where the country has high rates of exposure to naturally occurring asbestos. So occupational lung disease, the lungs are both the target organ and a portal for entry for toxins. And the conditions that may arise are quite varied, from being acute, subacute, some are chronic, with or without a period of latency. And they can range from being benign to malignant pathologies, occurring anywhere from the upper respiratory tract, so right up at the nose, all the way to the alveoli. We do have the classic occupational lung diseases, such as asbestosis, silicosis, and co-workers pneumoconiosis, which I'm going to go a bit deeper into. And these comprise a significant burden of disease, even in the modern industrial societies. If we've got time, I'll be able to show you just a small clip from the States right now, which is very topical. Among occupational cancers, lung cancer is the most common as well. So, what is our burning platform? What is the biggest issue? So at the moment, our burning, when we say burning platform in developed countries, there's been a reduction in manufacturing processes, and that also saw a decline in some of the incidents of things like silicosis, asbestosis, and pneumoconiosis. However, there's been a corresponding, call it, increase in things like occupational asthma. It's a bit different in developing or emerging economies, where the traditional lung disease are commonly seen much more than in the developed communities. Occupational asthma, on the other hand, is less so, probably because of the usage of new technologies. The consequence of occupational lung disease is both economic and personal. When we say economic, it presents an economic burden upon workers, employers, insurance agencies, as well as the general population, with productivity loss. We all know about presenteeism and absenteeism as well. When we say personal consequences, what do we mean? Well, you can imagine somebody has been in an occupation for 10, 20, 30 years, and then you diagnose them with an occupational lung disease, and then have to remove that person from that occupation to something else. It's very difficult to suddenly alter your course of life or choose another profession. We said it's a target organ, and why is it so significant? Let's just look at respiratory anatomy for a short while. So without delving into, sort of where it starts and where it ends, it's just the surface area that we have from the lungs. If we take the skin surface area as being 1.9 meters squared, your lung surface area is 28 meters squared. And when you take a deep breath, it's literally threefold, 93 meters squared. And when you're at rest, you're breathing at about 6 liters a minute. When you're in heavy exercise, you can breathe over 75 liters per minute. So with that rate and surface area, it exposes the lungs to damage from possible toxins. We do have natural mechanisms that do protect against airborne hazards. In the nose, the frontline barrier, the fine hairs that are there. You have the cough reflex that also facilitates the clearing of the trachea and the main bronchi. And then you've got special cells which destroy bacteria and viruses that do find themselves further in. The pollutant or the particle that's offending, the fate varies depending on several factors. The first of which is the particle itself, its size, its shape, its density. And then you look at chemical properties, alkalinity, fibrogenicity, and antigenicity. Then you look at, we talked about the clearance mechanisms, as well as the susceptibility of the particular individual, his immunological response. When we say particle size, we're referring to the fact that large particles get trapped in the nose and they don't find their way forward, whereas the very small ones may reach the lungs. You find that the toxic dusts are those that are in the range of 1 to 5 nanometers, and these produce harmful effects. In terms of chemical properties, you find that some particles will be dissolved and then absorbed into the bloodstream, whereas most solid particles are then removed by the body's defense system. The degree of solubility, it also affects how far or the effect of the offending chemical. For example, if it's highly soluble, things like ammonia, you find that the effect is in the upper respiratory tract or the mucosa of the eyes, the nose, and the oropharynx. Whereas the moderately soluble ones make their way to the mid respiratory tract system, things like chlorine, which then precipitate things like asthma attacks. Those that are very or sparingly soluble then make their way through to the lower respiratory tract, and things like nitrous dioxide can then produce that effect there. The particles that we talked about, the various particles, then produce the pathophysical effect on our lungs. So we've got your various inorganic dusts, things like the silica, asbestos, and coal dust that we talked about. Then you've got your organic dusts, things like cotton, wood dusts, grain dusts, etc. And then your toxic gases. All of these will elicit a biological inflammatory reaction. And then depending on, sort of what it is, you've got a varied response. For example, your inorganic dust can either produce a granulomatous reaction, fibrous reaction, or then end up as metaplasia. Whereas your inorganic dusts may result in impaired lung function, producing your occupational asthma and your allergic alveolitis. This pathophysiology allows us to also classify the occupational lung disease based on the pathology they cause. So we said that the inflammation can be either in the airways, the parenchyma, or the lining of the lungs themselves. The obstructive lung diseases that we talked about being occupational asthma, we can close that, the reversible ones, or the irreversible ones like emphysema. Restrictive pathologies are those that we said produce the fibrosis, which then causes the restriction. And we've talked about the key ones being asbestos, silicosis, and coal workers pneumoconiosis. The allergic alveolitis, which we will delve in brief later on, are also in part of that classification. We've used this pathology to classify. However, multiple forms of classification can also exist. You can also classify occupational lung diseases, dirty lungs, according to the latency. For example, short latency would be your conditions like your asthma or infections, allergic alveolitis, etc. Whereas the long latency are the pneumoconiosis and the neoplasma. You remember that things like silicosis can take up to 15 years before they produce an effect, and even longer with coal, where the latency period can be up to 30 years. In terms of the history of pneumoconiosis, it's surprising in that we've been talking about dirty lungs for more than a century now, and still we remain with the same problem. I don't know if this was in the automotive industry, whether conditions or problems would last so long. You get a problem on a Toyota and it's immediately recalled within the next few days, and something better is produced. So in 1866, Zenker coined the term pneumoconiosis, and it's derived from Greek, pneumon meaning lung and conis meaning dust. Later in 1874, Proust then modified the term to pneumoconiosis to connote dusty lung. Now pneumoconiosis is a general term and refers to a spectrum of tissue reactions developing against inhaled and accumulated dust in the lungs. The International Labour Organization has defined this as the accumulation of dust in the lungs and the tissue reactions to its presence. We talked about organic dusts, but these are not included among the pneumoconiosis. And in medical legal practice, the presence of dust alone is insufficient to indicate pneumoconiosis, and for compensation to be considered, mineral dust must be present and alter the structure of the lungs, thereby causing disability. So just a little on the pneumoconiosis, you'll note that we've talked about the commonest of these being silica, coal, and asbestosis. And these produce a fibrotic reaction with diffuse nodular or focal nodular fibrosis. The non-fibrotic ones usually will be as a result of exposure to the, say, siderosis is an example, where you've got the macrophages then engulf whatever the offending agent is, and then there's no fibrosis resulting. Allow me to just play something for you, and is anybody going to give me hazard a guess as to what's the issue there and what is the possible issue that we're talking about? Well, dusty work leads to dusty lungs. And you can see this lady there is grinding away on her tiles, opening up a conduit there, and there's no respiratory protection. There's a lot of dust accumulating, and she's in direct contact with it. So this is an issue that we find in many parts of the world that are undergoing a rapid economic transition and population growth, often with large informal and unregulated workforces, where occupational exposure poses a heavy burden of disease, confounded by non-occupational exposures, hobbies, and second jobs. For example, you're there as a tiler, you go home, you continue tiling for your friends, or you go into something like pottery, and the exposure continues. And the main thing is that there are no control measures being prioritized or implemented. This is even worse with the advent of new technologies, where new exposures to some new chemicals that have not been medically evaluated or been around for long enough for us to know their ill effects, as these are continually introduced to the workplace. So for those who said that lady grinding can end up with silicosis, quite correct. And silica has been recognized as the leading cause of occupational respiratory disease worldwide. And it's also recognized as a lung carcinogen. It was first described by our father of occupational medicine, Ramanzini, in 1705. and he had noticed sand-like substances in the lungs of stone cutters. And it's the silica or that quartz dust that produces the effect. And you'll find that the effect is marked in the inflammation and scarring is in mainly the upper lobes. So you'll see on this radiograph that the upper lobes are more affected with sparing of the lower zones of the lungs. And we talked about that nodular appearance as well. So you find that miners, construction workers, and those in building demolition and refurbishment are the largest occupational group exposed to crystalline silica. So you also have it in sandstone and granite cutters. Nowadays, granite is the substance of choice for sort of high-end apartments, etc. So working that granite to introduce into the home, tombstones, etc., is also a risk. And you find that we haven't implemented enough of the controls in those industries. Again, you'll find that in areas where there's silicosis, the silica exposure is a risk factor for pulmonary TB, especially when associated with high HIV infection. This, if you look at the picture on the right, is an example of silico TB, where you've got the silicosis and then you've got the TB nodules as well in there. So the importance of these was recently demonstrated in a study in South Africa, where they had isoniazide as a chemoprophylaxis, and they found that it failed to work. Why? Because of the silica in South African miners. We talked of emerging communities or emerging industries, and increasingly, silica-associated lung disease is being seen in this community where it's been largely overlooked as a risk factor for silica lung disease. We're talking here about things like the dental tool suppliers, jewelry makers, tilers, denim jean manufacturers, and artisanal small-scale miners. You'll see this in the bottom picture here, where you've got these ladies busy doing gold mining, panning, and they're exposed to dust with no PPE whatsoever. But the military personnel is another area of a group that we never think about. Our picture here, you'll see you've got the soldier there, helicopter over, then you've got all this dust and no PPE whatsoever. Some studies that were done by the American Thoracic Association looked at this, and they did a case series which demonstrated that there are more frequent encounters for respiratory symptoms, airways diseases, predominantly asthma, and a variety of other abnormal respiratory tract findings in military personnel who were deployed as ground forces versus non-deployed. And that those people that were deployed developed lung disease as a result of fibrosis and a decrease in pulmonary function. The authors noted that the data from sources that regularly study this population, that asthma was the most common specific diagnosis, and in previously deployed military personnel. In fact, 50% of deployers discharged from the military had asthma, and they didn't have asthma prior to engagement or enlistment. The other significant dirty lung is asbestosis. Asbestosis is a material that we've been using for sort of a couple of centuries now, since the late 1800s. It's been used widely, building industry, in the shipping industry, car manufacturer industry as well. And it's because of its strength and durability that it also produces ill harm effects to us. Typical asbestos which produces our issues, has long, thin, fibrous crystals. And these fibers can accumulate in narrow branches of the airway, inflaming them, producing some scarring, and then producing the interstitial pulmonary fibrosis, a picture of which you see at the bottom here. These long brown things here are your asbestos fibers, which then cause the reaction in the surrounding lungs. And you can see the fibrosis on all these post-mortem specimens. The fibers can also migrate through the pleural lining, causing plaques and further restricting breathing, with pleural effusions, fibrous plaques, as well as pleural fibrosis. Neoplasm can result, and you can get the mesothelioma in the pleura or the bronchogenic carcinoma or laryngeal neoplasms. The other dirty lung, the anthracosis or coal workers pneumoconiosis, although once in decline, there's increasing resurgence of its prevalence and severity in the States has been reported. In the States, they're not sure what the resurgence is, but the respirable, silica and metal content of coal mine has been implicated. There's a publication by Hall et al., which assessed the prevalence of R-type opacities. R-type opacities are rounded pneumoconiac opacities measuring between 3 and 10 millimeters in diameter, and these are typically associated with lung disease. So Hall et al. Assessed these R-type opacities during the period 2010 to 2018, and then they compared this with data from 1980 to 1989. And what they found was that there was an increase in prevalence of up to 6 times of R-type opacities in that later period of 2010 to 2018. And this study demonstrated that the growing prevalence of opacities is something that needs control and monitoring for US coal miners, because, obviously suggests that there's significant exposure to respirable silica in coal mine dust in workers. And then other pneumoconiosis in arc welders, we look at the deposition of iron oxide, which also produces a dirty lung. Your organic dust, we said, is not one of the pneumoconiosis, but it leads to dirty lungs. The pathology here is slightly different in that an antigen-antibody reaction occurs in the acute phase and leads to acute hypersensitivity pneumonitis. With continued exposure, you then get the formation of granulomas and chronic interstitial pneumonitis. At the top picture here, you'll see hay that's beginning to mold, and this typically causes farm workers' disease. Cotton causes your bicynosis. Then you've got your bird keepers or bird breeders' lung disease is your result of the bird droppings. In the industry which I work, which is sugarcane production and milling, the crushed sugarcane produces bagasse, which is the leftover fiber, and the actinophilic bacteria there then produce bagasosis. The other class of lung disease, which is of concern, especially, as I said, in the developed communities, is that of occupational asthma, which typically we characterize by variable airflow obstruction and hyper airway responsiveness due to causes and conditions, note this, attributable to particular working environments and not to stimuli encountered outside the workplace. So when you're doing your occupational history, it's important to look at all the jobs that have been held during the employee's lifetime and the duration of those particular jobs. Key questions to ask are, do symptoms improve with weekends and vacations where you're away from the offending agent, so that at least this gives you the link to causation. One of the key things to note is the longer that people have been having symptoms of occupational asthma, it's really becomes quite difficult now to separate the connection between the symptoms and work. In terms of what to do in prevention of occupational asthma, we're talking about reducing the exposure. Key to this is the pre-employment screening, where you identify those people with a predisposition to getting asthma. Education is also key, and then screening for potential respiratory sensitizers. Carter and al. Did an evaluation in a workplace where they were looking at cleaning service workers, and they estimated that workplace exposures account for 16% of cases of adult onset asthma. They evaluated a range of cleaning materials and the occupations at greatest risk of exposure and development of dirty lungs from a period 1999 to 2017. They found that launderers, dry cleaners, and pressers had the greatest risk of lung disease due to the exposure to these cleaning chemicals. And the most frequent offending agents were the aldehydes and the chlorine. So in terms of our approach to dirty lungs, and there's certain key take-homes that we just need to understand. First, for the etiology, maybe multifactorial, and occupational exposures interact with others. We've talked about that as the example in Turkey. The dose of exposure is an important determinant of who is affected and how severely that person is affected. While individual susceptibility as well does exist, and this can then determine the severity and outcomes. One of the key things about occupational lung disease is that there's usually predictable latency periods. We talked about silica having a 15-odd-year latency period, while coal has about a 30-year latency period. So it's often predictable what, when you have effects after a long period of time, which offending agent it might be, if you've done a good occupational history. And then with each of the offending agents, there's usually a known pathological process, like we talked about fibrosis in silica. Evidence of causation by a particular agent may be difficult, but the importance of an occupational history is fundamental. Obviously, you have to exclude other alternative diagnoses. So talking a bit further about our diagnosis of dirty lungs, we said the key bit of it all is the history. The history of the presenting illness, yes, that's one side, but the occupational history is what's really essential, because it's from the occupational history that you're going to get details of the employment, what occupation that person was in, the type of industry and the specific work they did, the employer, the duration of employment, as well as the exposure information. Why is this important? It'll give you, you need to look at the general description of the job process, the overall hygiene in the area, what methods were used in terms of call it dust suppression and dust extraction, etc. Materials that were used by the worker in the work, and then not just the worker, others. You may be working next to somebody who's grinding something there when you are doing something different. So it's also important to elicit such history of exposures. Then you want to look at things like the use of PPE as well. Details of past employments in chronological order is also essential. Physical examination may be helpful in ruling out non-occupational causes of respiratory symptoms, but generally the finding is that it's unrevealing about the specific cause. So while you may have a physical finding, to correlate it with a specific cause is near to impossible. Common tests that will then be used, chest radiographs Yes, they're very good as a screening method, but they're very low in sensitivity and specificity. CT scans, while more sensitive, their specificity is also quite varied. Your various tests, your lung function testing, will help you elicit some of the effects. We talked about the restrictive and sort of obstructive and obstructive pathologies that are occurring. Bronchoscopy, thoracoscopy, as well as the open lung biopsy and postmortem are also sort of key tests that can be used in diagnosis of dirty lungs. But at the end of it all, remember that occupational lung disease is a diagnosis of context rather than just, sort of this test means that. You have to put it all together. And key, as we said, the occupational history, that history of exposure is fundamental. Treatment of occupational lung disease is the same as for that of non-occupational lung disease. And you find that treatment then is by primary care providers, can be occupational medical physicians or pulmonologists. And really, it's because the symptoms are the same as non-occupational lung disease. Usually you don't separate how you treat. It's more the symptoms that you're managing. And often, by the time of diagnosis, pulmonary conditions may have progressed so that your treatments are then just symptomatic. Acute onset diseases may resolve on their own once the employee is removed from the offending exposure. The chronic lung diseases often have a long latency period, as we've talked about, and show a slow progress over many years. So you need to manage those symptoms over a long period of time. When you talk control and prevention of lung diseases, NIOSH have put across a very good approach to how we control and prevent lung diseases. And they've structured it into 4 main pillars. And the 4 pillars, the first of all is the reduction and elimination of exposures. This is your primary prevention and prevents workers from being exposed to those unsafe levels of hazardous materials through technological processes and change in your work practices, materials that don't produce those ill harm. The next pillar or column is your environmental and medical surveillance. This is key to providing data on certain industries and the occupations of the risk of occupational lung disease. So the studies are useful to determine the incidence and prevalence of disease in all industries that have known hazardous exposures, and therefore allowing the appropriate interventions. Education and health program. This is fundamental. A comprehensive training and information program based on sound educational principles to fully inform workers, engineers, managers, and health professionals about the hazards, the control measures that are there in the industry, and also about the additional dangers presented by cigarette smoking and the benefits of not smoking. We talked about, sort of the silica and smoking and TB, etc. Then lastly, research, regulation, and enforcement. This here, unfortunately, is very lacking, especially in emerging or developing communities. We require stringent medically based regulation of exposure levels for all substances that have an implication in dirty lung disease. At the same time, while you may have, so the regulation is nothing without monitoring and enforcement. And this is key. So you find that a lot of our countries, communities, if you look for regulations around all these things, you will find them. But the actual enforcement of those regulations is really what we need to step up on so that we improve on that. That leads me on to almost my last slide, and that is really when we talked education. ICO has an online workshop running in November, on international classification of radiographs of pneumoconiosis. So for those of you who are interested, this is something which is very good. It will take you more into depth in terms of classification of the radiographs of pneumoconiosis, the epidemiology, pathophysiology, diagnosis, and clinical course of various exposures, the asbestos, silica, etc. So I think for those who are keen, this is part of that education arm where we're wanting to improve the knowledge among our community of reading X-rays that are typical of pneumoconiosis. I want to acknowledge my various sources of input into this presentation, and leads me to my last bit where I'll open it up for questions from the floor.
Thank you, Tongai.
Gogi, it's back to you.
Yeah, thank you, Tongai. Thank you. It was a very good presentation which you have covered from the beginning on the causes of the dirty lungs up to the management in the workplace. I have some questions here, Tongai. Can you hear me?
Yes, Gogi, go ahead.
Yeah.
Sorry, the sound's
Okay.
a bit low. I'm not sure why it's very faint, but go ahead. I'll try.
All right. Let me. All right. Can you hear me better now?
It's a bit better. Go ahead.
Right, okay. Well, there are participants who are from on the online in Zoom and YouTube, and we also have participants physically here in the auditorium. So there are some questions from the participants here. Right. The first question is, how do you do screening for cases for workers who are exposed to pneumoconiosis? Do they have to go through chest X-ray or lung function test is sufficient, or spirometry? Is that sufficient, or they have to go through both the chest X-ray and lung function test? These are just for screening.
Right. So remember, let me, even if I take you back a bit, even in screening, you start with the exposure. So it's your questionnaire is the first thing that you start with, even before we get to the test. So I know the question was, yes, you've got a subset of people who are already working in dusty lungs. What do you do for that? So you do a screening questionnaire, and the screening questionnaire is going to look at symptoms, especially the type of exposure that person is going through, because it will then speak to the other things that you've just asked about. The screening, your chest X-ray, your lung function, yes, both of those are key, but you have to relate that to your questionnaire. Your questionnaire is going to talk to you about what exposures that person had, the duration of that exposures, and then also the occupation that they're doing, right? And what symptoms they may have. So you want to relate all three to what you find on the chest X-ray and the lung function testing. So yeah, your screening mustn't be people walk in, they have a chest X-ray done and they walk out and you think you've done, your screening. No, it has to be comprehensive, and you have to include all those various things that we've just talked about in terms of our presentation.
Okay. Thank you very much, Tongai. That's another one. You mentioned all the types of pneumoconiosis, right? Like siderosis, stenosis, bicyanosis, anthracosis, and asbestosis. How would they differentiate this? Is ILO classification radiograph pneumoconiosis is important? Do we, as an occupational physician, have to use that classification to diagnose this? What's your opinion, Tongai?
Okay, so you again on my last slide that I showed you of the online course that we are offering through ICO, it assists you to understand the value of sort of chest X-ray in the classification of diseases, and it also explains the classification itself so that you're able to understand sort of what's the difference between diffuse fibrosis, nodular fibrosis, TB, etc. So it is imperative to go through that. If you are dealing with sort of pneumoconiosis, that understanding is deepened by the ILO classification. And the beauty of it is it allows you then to be able to one monitor over a period of time where the person progresses, because it gives you your categories as to, sort of you starting from one or, to your various steps. So if I take an X-ray today and I look at it again, several years later, you've got an objective measure of or classification of that particular pathology. And I gave you the example of the Appalachian experience, where they did a series looking at just the R-type opacities, the 3 to 10 millimeter opacities, and they're then able to evaluate X-rays from 1989 and 2017. So you're able to compare and with an objective measure. So it is important and a very, very useful tool in classification of pneumoconiosis.
Oh, okay. All right, we got it. Thank you very much, Dr. Tongai. And I think we are honored to have you, and hope to see you for next in future webinars. Thank you, Dr. Tongai.
Thank you, Gugi, and thank you to the audience. Have a great day further.
Okay, so dear audience, let's move on. According to Health and Safety Executive UK, every year more working days are lost due to work-related illnesses among the construction workers. They have a high risk of developing diseases for a number of health issues such as cancer, musculoskeletal disorders, noise-related disorders, and respiratory illnesses. To know more about this, I would like to invite Dr. Krishna Nirmalya Sen, who is an engineer with over 3 decades of experience in the construction industry in varieties of roles. He is a chartered engineer, fellow and professional engineer from Institute of Engineers, India, and fellow of Collegium Ramazzini, Italy. Dr. Krishna is also the chair for Scientific Committee on Occupational Health in Construction Industry and President of ASSP India Chapter and Chair for Occupational Health and Safety Expert Committee of Indian Chamber of Commerce. Dr. Krishna, please welcome.
Am I visible and audible?
Yes, very well.
Great. Yeah, I think good afternoon from here as well. It is 12:19 as it clocks here, and I'm sure you all have, after lunch, there was a fantastic presentation which I had the privilege to be a part of it. Thank you very much for inviting me across various locations. This program is being organized. As you know, I come from profession of engineering, and I've been a construction engineer for quite some time at the beginning of my career. So my presentation is primarily focused on the experience which I have as an occupational, initially safety and then health, occupational safety and health professional in the field. So I will try to give you some perspective from the injury prevention as well as the occupational health perspective as the program is. If I can I share my presentation? Yeah. Is it visible? Is it visible? My presentation is visible?
Yes, it is.
Okay. So as you know, this is basically the focusing on some challenges which we have when we work in construction industry, which in a way we say 3D industries, dirty, dangerous, and demanding. Okay, so this industry, as you know, has a lot of physical challenges, and people are exposed to various harsh conditions like heat, dust, and other chemical exposure as well, and musculoskeletal disorder. So I'll not go to the definition of health, occupational health. We all know about it. I'll go to the next slide. This is very important to actually see. You see, if you see the global estimate, we have around 395 million workers which is having non-fatal work injuries. That is the injury concern. But that injury is actually going up and up, almost 5% increase from 2015. But if you see the fatality, in the fatality, there is a very important revelation. The disease is actually taking the maximum toll. If you see the work-related disease, that takes away around 2.6 million people from us, while the injuries data, which may be not exactly so accurate, but it takes only 11.3%. But as in industry, we get more and more agitated or having more and more ORIs, or you can say the cases. The more prominent thing is basically on work injuries. Unfortunately, the health-related issues globally do not get that importance or that perspective, because it is not many a times in countries like ours, and also maybe other developing countries or the mid-income countries. There are focus on injuries, but not on health. But if you see from the statistics, work-related diseases, wherever, of course, the data is available, is very high. So we need to focus on occupational health to a great extent. And you can see the region of our region is having the highest share, about 63% of global work-related mortality. So this one, I wanted to highlight the importance of occupational health in overall in the domain of occupational health and safety. So if you see the risk factors, the high risk factor is relevant because in construction, traditionally, not only in a particular country, but traditionally, long working hours is given. So people are not working only 7 or 8 hours, but many of them are working for 10 hours or 12 hours. That is another, given factor, which many a time, there's a lot of research, including one, Nobel Prize on circadian rhythm, maybe 6-7 years before. So this long working hours is a big issue, and then air pollution, and of course some amount of injuries. So this is a great focus we should have, particularly in construction industry, to limit the working hours, because it is very stressful. It has a lot of challenges inherent to the job, working at height, working underground, in the tunnel, and so much of challenging locations. While the working hours in offices are more regulated, the working hours in construction site, unfortunately, is not so well regulated across the globe. And if it is regulated, still there are ways and means by the employees and or workers as well as employers to find somehow to engage them in various methods, keeping their health at risk. So this is again in continuation of that. I personally have been a very strong advocating person for these working hours limitations, because I know the people who work at construction site, how much demands it goes to their physical, their body, and how much they get stressed. If someone is working at 40, 50, 60, 100, 200 meter height, including chimneys, when they come down, go up, even they go by lift as well. Sometimes they have to climb 30, 40 meters by stair, or they have to go by, by ladder, or they have to go by MEWP. So in each case, there are different types of challenges. And that is why it is very important that the working hours is contained within the limit. Now, if you see the top factors, which is a global factor, and I think that is very important to relate to our industry, the construction industry, as I mentioned, our working hours, the particulate matter exposure, injuries, as in asbestos and other things. So all you will find in the industry which we are talking about, more so on working hours, exposure to gas fumes, and other injuries as well. So with this, I come to the figure of construction. Now, as you see, construction is actually contributing to 6 to 10%. Some in our country maybe 7 to 8% of the global workforce. But if you see the pattern of this workforce and very unique nature of this workforce, they are migrant within the country and outside the country. In India, even the developed part is the western part. So many people from eastern part and go and stay. If you see the Middle East region, or even the Far East, for example, Singapore, a lot of people will come from the neighboring countries and they will become a part of the development. If you talk about even within the country, like in India, the people who migrate 300, 3,000, 4,000, 3,000, 2,000 kilometers from one side to the other, or even 500 kilometers from one city to the other, they face a lot of problems in terms of, so that migration also have some bearing. And if you see the fatalities in construction, around 60,000, which is, I think, a very conservative estimate. And even then, that is a very big, large number. So, and we had done a white paper. I think 30% of construction workers suffer from back pain. But if they are working for a lifetime, then almost 100% workers actually have MSDs. If somebody is working continuously from one project to the other project, then they will be almost, if that person, 100% of those population will have. But there are some construction workers who generally do it seasonal, like they work for some time in construction, then they go back to some agrarian activity, some other activity, and then again they come back. So they get some break in between by the nature of their design of their lifestyle. They have their own land. They go and do the cultivation for 3 months, 6 months, and they come back. So these people get less affected. But if someone is working, some people are working for continually for construction activities from one project to the other on a back-to-back basis, then they have a very high rate of MSDs and all. Now coming to some of the factors which are intrinsic of construction industry, and that I just wanted to highlight some of those points, not all. Some of the point is including that high risk, the jobs are basically high risk, okay? I mean, if we use 5x5 matrix, probability and consequence, to define the high risk is a very, very reliable way of defining the risk. We can also use 3 or 10x10 matrix, but generally 5x5 matrix is well accepted. So we use that matrix and define. And you see most of the construction activities will come to the bracket of 4x5, 4x4 or 4x5 or 5x5. And that is why we say that high risk activities are basically, most of the activities are high risk. Now there are other issues, which are, some of the issues are very soft, and some of the issues are, we cannot do much about it. Like, for example, presence of subcontractors. The main employer may have subcontractors and subcontractors. So their control and the communication become, very difficult or not very robust, and that creates a lot of safety and health issues as a process of management. Those who are from the industry, they can well understand this, how the line of command and how the things which should communicate and should the benefits, health and safety benefits, may get diluted, and because of the layers in between. Now, lack of skill and education, because there have been a lot of research to establish that high skill has, can influence, like, accidents or injuries, because and also diseases, because the person with high skill will be aware about precautionary measures. He'll be able to do the job in a manner which will reduce the risk, and also the education. So many people come to this field without much formal education. They learn the skill, sometimes little wrong way, sometimes they do not know the right one, and sometimes the skill, before they get matured in the skill, they take up the job. So lack of skill or inadequate skill or unsuitable skill, I bracket it as a lack of skill. And also education can be a health and safety problem to a great extent. Now, high rate of turnover, like, we sometimes see, if you see annually, 4 to 5 times people are getting, churned out. Like, you have 1,000 worker average, suppose in a project, you may get 200 people every month entering. And, still you have 1,000 people. That means, you are getting 1/5 out every month, and that create a lot of safety and health risks, because many of them will not, will take time to understand, to get acclimatized, and by the time they may be exposed to high risk of activities and high risk of, injuries and also diseases. Low level of mechanization. Now mechanization is going up and up. But in some of the sectors, like some residential sector and some small scale sectors of construction, the mechanization has not gone to that extent. And smaller builders, you see the multinational companies and all can afford to have a lot of mechanization, cranes, equipments, but then small companies and doing smaller industrial projects, smaller investment, have lack of mechanization, and then there's worker exposure, number of workers, number of exposure of those workers to various risks can become higher, and that has a very strong. And then poor working and living conditions because of the dynamic nature of the industry, because many of these, industry are in a greenfield, and even in the brownfield, the greenfield portion may be separated. If it is a expansion or if it is a modification and all, sometimes you may have a better living conditions because there may be established facilities. But in a greenfield, sometimes the workers face a lot of challenges in the initial days and also in the closing days because of the facilities may not be available, like welfare facilities, rest facilities, washing facilities, and things like that. And I have already mentioned about extended working hours as a part of the construction business. Now, if you see the the leading causes of fatalities, it goes from primarily the major hazard in construction is, I have taken the OSHA data from OSHA because other data are not, I thought, may not be so specific, but it is a globally used, reference. So I use this one. So if you see the major causes of fatalities is primarily from fall, there is fall from lower, higher level or to lower level. Maybe it can be fall from height to ground level, or it can be fall from ground level to the minus level. So fall to lower level, and then it can be stuck by any machine, equipment, moving things like crane movement or other equipment. So it can be stuck. People can be stuck if that is not noticed properly. Electrocution, because of the temporary nature of the projects, a lot of people get exposed to electrical shocks and the consequent, trauma and things like that. So electrocution is another one, which is also a global, challenge for construction, and also caught in between the machines and things like that. So this is what I thought I will, basically say. That I'll go to the specific high-risk activities. Some of the activities like working at height, you all know about these ladders, scaffold, roofs, slip, trips, and falls, electrical hazards, heavy construction equipment movement, management, maintenance, unguarding machineries, machine guarding sometimes not provided or removed during maintenance or during operation for some reason. Then another is the excavation. People can fall in the pit or get entrapped in the trenches. And also high risk is basically working in confined space. Confined space can be tunnels, can be tanks, can be pipelines. So it can, it can be many, examples are there where confined space is created as a part of the construction activity, and the workers are exposed for various reasons to go in the confined space, do some work, and come back. But then during that process, they get, and sometimes confined space, there may not be any poisonous gas, but there can be simply nitrogen. There have been situations where the chemical flow in the tank because of maintenance work, construction work, or removal, the tank the supply have been closed, it has been completely cleaned, it has been purged with nitrogen to ensure that no poisonous gas or no hydrocarbon and everything is there. It is purged for some time. But after purging, it is important to also ensure that air is given so that you have enough oxygen. And since nitrogen is a constituent of our air, 9%, 79% to 89%. So 21% is the oxygen, and balance is nitrogen, and now you have other things. So what is the problem when you have full nitrogen and you have not put air? If a worker is going and he is not checking the concentration of oxygen before going, he will not realize that he is going to die within a second of entering, and that is another challenge, not because of poisonous gas, but just because of lack of oxygen. So these are all, very, very important areas in construction, and we have a chance of losing people if the management or if the engineer in charge who is creating this risk and not take care about the people there. So if you see the common hazards, those are all slips, trips, falls. We have all discussed about this. Chemical hazards like welding fumes, vapor, gases, construction dust. My previous speaker have very detailed spoken, so I can save some time on that. But I'll more focus on the areas which we most, and also ergonomic hazards, for example, the postural problems, the design of tools and tackles, the traditional tools. Nowadays, many tools are developed which are more ergonomically, comfortable or more ergonomically designed to the user and being user friendly. Because many of the jobs are repetitive, like for hammering and nailing and breaking. Sometimes people are using pneumatic breakers, manual breakers. So you have a lot of vibration from those machines, and very important to have right sort of PPEs, shock absorbent, machine handles and things like that. So I think those are all things which we require to take care of. Now, if you see from the disease part of it, you have the occupational cancer, respiratory diseases, musculoskeletal disorder, which can happen because of multiple multiple type of activities, multiple times, noise-induced hearing loss, skin diseases like dermatitis and burns, heat stress, and of course, mental health disorder. I must talk over the last point a little bit because the other points are anyway being covered. But you see a lot of mental health issues are there for the migrant workers because they go far away. Many of them travel for 2 years or even 1 year, 11 months. Particularly the worker category, maybe the management, the engineers, the supervisory type of people may come back every 3 months, 6 months, and so. But the manual workers, they may get lesser opportunities to come. And I met, when I go to international projects, I meet sometimes people on the flight or even on the site, and I ask them, when you came back, when you came from home and when are you going? I think many times people say that I will go after 11 months, or sometimes people say I will go after 2 years, something almost 23 months or 22 months. So that become very challenging. Of course, today, fortunately, with the technology and the platforms available to communicate is much more. I think that gives some respite. But even then, missing the near and dear ones have a lot of challenges, and also there can be bullying because many times people will be from various places, staying together, and so all this, there are a lot of challenges which can happen because, and there can be age difference, like people are coming from I have seen people like in their early 20s, and some people are in the late 50s or early 50s, and if they are very close by, there can be sort of stress. And so it is very important that these are small issues but can have a very large impact. And suicide and all are not very it is not very astonishing because there are people who are resorting to that sort of options as because of the mental health, and it is not also diagnosed if on time. So these are problems, global problems in the construction industry sector. Now coming to the ILO declaration, which you all know, and it has now become a part of the fundamental principles and rights, and we're very happy about it as a safety and health professional. And and that talks about a lot of a good thing like and then elimination of child labor and things like that. I also like to relate this with the safety and health with the global sustain SDGs. Out of the 17 SDGs, it is very prominent. I am highlighting only 2, but then there are other other goals which can be very well directly or indirectly connected to these UN goals of sustainable development goals. So there's so for example, goal 3 calls for ensuring healthy lives and promote well-being, and goal 8 calls for the promotion of sustained, inclusive and sustainable economic growth. So productive employment and decent work, because these are all important areas of construction industry, because many times the owner or the employer is not able to provide the decent work situation for the construction workers because of many challenges, the dynamic nature, but it is very important that can be done. And there are industries globally and of course locally who are doing extremely good on these fronts as well. Now, as you all know, ESG has come last maybe few years, and it is talking about environmental, social, and governance, and it is a matter of great satisfaction for us in a way that the respective governments and respective regulatory authorities are focusing on ESG rating and the financing of projects or financing of companies, global financing institutions. You're also looking at the ESG rating for their investment and for ensuring that their investment is not getting damaged or getting challenged because of the poor ESG rating. So I think this is giving a marker or a sort of reference point, and that their health and safety plays a important, you can say, is an important constituent in that ESG canvas or ESG parameters. So because safety and that is why I think, as I believe, and already getting that sort of message and sort of response that the management or the leadership of the companies are looking at the occupational health and safety more and more keenly, because if the ESG rating become poor, then their chance of getting investment or sort of contract or things like that can get damaged or can get become poor. So I think that is a good news. In India also, a lot of focus is on ESG, and I think as a safety and health professionals, we have a huge role to utilize this thing to improve the working conditions for the workers. Now, I just wanted to bring quickly, a fundamental principle of risk control, and that is Vision Zero. And Vision Zero is basically, a new concept, maybe 6-7 years before, or maybe a little more, but talks about 4 important pillars or principles, and those principles are very much well aligned. Those principles are: life is not negotiable. Human beings are fallible, and tolerable limits should be set for physical and mental, because every individual have the tolerable limit for various things, and then and the people have the right to safe and healthy work. I'll not go much deeper on this, but I think the safety, health, and well-being is a core a core areas for Vision Zero to ensure the work is done safely in a healthy manner, and the well-being, overall well-being of the workers is or workers or employees or the stakeholders is ensured. So this is basically on this Vision Zero is based out of 7 important parameters, I should say: leadership, hazards, identification of hazards, defining safety targets, having safe systems, having right technology, and developing competence, and looking at the people for the people's welfare and things like that. So this is a risk control strategy, recent strategy, which is globally getting more and more popular. I am sure that many of the resources are free, so you can Google Vision Zero and get those reference document. And if there is any specific request, I can always be able to help. So if you see the 5 important points, because these 7 elements of Vision Zero actually can help immensely on our health and safety journey. And that starts with the leader, because if the management or the leadership is focused on developing the health and safety conditions, whether it is construction industry or any other, but more so in construction, because in construction, the leader plays a there are many industries which are basically, well established. The influence may be much less. But here, day-to-day work is dynamic. The risks are ever changing. People are changing. So the leader, respective leader, because leader is not the only one man at the top, the CEO, but every level there is a leader, and those leader has to be every level leadership has to have a demonstration of commitment during their activities. They are talking, they are assigning of the workplace and all. So then the safety and health actually become. And then the second important point, which the previous speaker has talked in earlier in the morning about the hierarchy of control and all, which I will come in a maybe a little bit in that way. So systematic hazard identification and risk assessment, control measures, identifying what can be the hazard and all, safety hazards or health hazards, and then any incident, if there is any near miss incident in terms of health and safety issues should be properly investigated, because that gives a lot of information on how it can be prevented or in the future. Then targets, we cannot have target for having injuries and health problem, but we can have smart targets for the positive activities like training, inspection, audits, workarounds, and things like that. Who will do it? Touching hearts and minds of the worker, giving them the feedback, appreciating good safety. Somebody drives me safe 100 kilometer, and I get down and I can appreciate him. Hey, you did a great job. You did not, overtook on the wrong side. You did not take up the call when it came. So it is not that always negative, but it can also be positive feedback. I go from one project to the other, and if I have a chauffeur or driver, we call here, can be given a positive feedback, and maybe sometimes negative feedback, and that it could be one of the targets to improve the working conditions and have a safer. And that can be many such construction examples when people are coming down from after working at height. The supervisor or the engineer can appreciate or all can give a feedback that yes, you have done a good job. Somebody might have done something wrong, can be also given a feedback on the concern part, that what can go wrong to him and what could be the consequence to the family, something like that. And then the goal 4, if you see the insurance safe and healthy system, a part of Vision Zero, that is have a right system, management system, health and safety plan, having the right resources, training, effective control and measuring mechanism of various hazards and various positive proactive actions being taken, and review if there are deficiencies. There will be deficiencies in any construction project. So identifying them, reviewing them, and focusing on control and improvement by the leadership. So this is a process which actually helps us to control the health and safety hazards which are emerging in the project sites from the beginning to the end in a various different ways. And then equipment, because construction, as I said, that low mechanization in some way, but that means there are some sites where are high mechanization as well. So projects vary from low mechanized project to high mechanized project. And even in low mechanized project, there are some equipment. In high mechanized project, there are many equipment and more new technology. And it is important that because many of the equipment goes from one project to the other, they get transported, dismantled, reassembled, refitted. And it is important that they remain fit, healthy, and tested. Regular inspection, day-to-day legal requirements are varying from countries to countries. It is important, and also have the right competency for the operators. And if you see the competency development is very important for, as I mentioned in the beginning, the skill has a huge role. So people have to understand the new risk, the existing risk. For example, crane operators, drivers, and there are multiple equipment, drilling machines, piling, and so many other equipment. So everybody has to have the right competency, equipment-wise knowledge, and things like that. So, and then experiential learning with experts. I will come to that in a little later, how the virtual reality or experiential learning facility can help in a way, because of the digital training is now available with us. We started initially with experiential learning. I visited one learning facility in Korea, and that was a very fantastic facility of GSE&C, if anyone is from there. And then we created some virtual reality, some experiential learning facility here as well. So it's a very good way to do the things for the workers and to learn workers and management people. And the last but not the least of the 7th pillar is invest in people, employee motivation program, and things like that. So these are all, you can say, the Vision Zero. Then I go back to my main presentation, which is the construction safety and health is basically on the larger, dimension. If you see the construction activity, a huge impact can come with a proper planning. Now, construction is, if it is not properly planned, not properly, mobilized, and suddenly started, then you have huge problems. So planning is very, very important from the beginning to the end of the project, having the right resources, right people, right equipment, having the commitment of management with EHS objectives, proper resource allocation, funding for training facility, personal protective equipment, various other safeguards like hand railing, safety nets, and many other gadgets like circuit breakers, residual current circuit breakers, sensors, virtual reality training modules, virtual reality training sets. You need many, many things to do, and also the softwares connected to it. So it is very important the management have the commitment and also allocate the resources, the people, and the equipment and things like that related to EHS, health and safety. Then identification and assessment of risks. What are the risks and opportunities as far as ISO standards are concerned? Training the people on a regular basis, because the people turnover is very high. If the turnover is very high, the training has to be a continual process. Some people, of course, it is a natural for people to learn and forget over a period of time. So that from one side, that training has to continue, but also training has to continue in a more way because many people are going away. The stakeholders' involvement, workers' participation is also very important to see that the workers get involved in the safety, health and health planning process. They are aware about the risks. They are aware about the emerging challenges and take precautions accordingly. And another part is very important is to have the right reward and motivation, because workers or the employees and every stakeholder have to have the right motivation to work in a safer and a hazard-free manner. So these are all things which now it's very common for a safety engineer or a occupational health and safety profession to talk about hierarchy of control. As we all know, the PPE, which is very, very important, actually comes at the last as the last line of defense, and we should actually focus more and more on elimination, substitution, engineering control, administrative control, and of course PPE. But many times I have seen the construction managers, the line managers, we call them, will say that, no, I have given PPE, I have put some safety boards, I have put some training program, but they're not focusing on the elimination. So I would rather say that you should try to eliminate. Some of the risks can be eliminated. Some of the risks cannot be completely eliminated, but you can have a substitute. And some of the risks which cannot be eliminated or substituted, or maybe substituted in some way, you have to have engineering control like machine guarding, RCCB, electrical circuit breakers, and all these things, sensors and all. So those are all engineering control, and have a little bit of medium sort of effectiveness. And then when you have a medium sort of effectiveness, you have to have two more steps to be taken is administrative control like training, permit to work, more supervision, some sort of behavioral programs. So you are actually trying to, because you are brought to engineering control, then you have to, but you cannot depend only on administrative control or PPE, because absolutely only on administrative control or PPE managing the risk will be very, very very less effective. Yes, you can try, but then basically you have to put more focus on the higher level of controls, engineering control at the minimum, and then administrative control to support it, and PPE, of course, to further support it. So that is how actually we should rather focus. Now, in the previous sessions I have seen, we have a lot of discussion on the carcinogens and the chemicals, wood dust. They're all commonly available at various activities, painting and then waterproofing, woodwork. Many woodwork happen in construction, from the shuttering to the basic civil activities, and then further ultraviolet exposure during welding, and of course people who are outside working for a long time. So we have to take care, and first primarily the awareness is very, very important, and then we have to give a we have to, wherever possible, we can reduce the chemical, hazardous chemical to a lesser hazardous, if possible, or even non-hazardous. Then guards and exhaust exposure time can be reduced by rotation. Like if somebody is working for 8 hours, maybe he can work for 4 hours and then, in a particular job and goes to another job where exposure of chemicals can be avoided. And of course PPE. But I know we all know about the PPE's some sort of limitations in it is important, it must be given, but you also have a lot of limitations. And many times the PPE, if not properly used, it gives a false sense of security and expose the worker or the person more and more to hazards, because people think that I have a PPE and I can go and I can do this, but actually the PPE is not serving the purpose, because it is not properly fitted, or it properly maintained, it is not properly used, the direction may be wrong. So all these things can become a problem, and that's why the more focus is on higher level of control, that is elimination, substitution, and engineering control. So as I mentioned at the little earlier, that the musculoskeletal disorder could be a big issue in construction, because people are doing various types of activities. In some countries, the cement bag is still 50 kg. Cement bag is 50 kg. Can anybody in this audience, including myself, at least I cannot lift a 50 kg bag, but that is the legal limit in some of the places, and that is a problem, because the spirit of the limit is that you can maximum lift 50 kg, not that you have to lift 50 kg. I hope I'm clear. So that means you can lift up to 50 kg. That means you should lift 10 kg, 20 kg if you can lift that much. But the interpretation of this by the employer can be, or the engineer could be different. He may think that law permits up to 50 kg means 50 kg. That become a big problem. And if the load is, suppose the cement bag is 50 kg, 2% handling it, maybe you can see that, but it is difficult. It's a small thing to handle by two individuals, and I think that creates a lot of challenges, and it can even kill a person if he falls in a wrong way. The bag falls, or his neck can break. So it's very important that the load limit and load shape and mechanization wherever possible is used. You can use 50 kg bag, but you mechanize it, and don't have a human exposure. Have a trolley, put it in the conveyor, take it there, open it, and pour it if you require. But avoid individual exposure if you cannot limit the load. So that is one. Then I have talked about mechanical lifting in a way in this, and modifying work practices. Have for example, cement bag. We are now replacing cement. The importance of cement bag are being replaced by direct. It is coming in container. It is directly pumped to the silos, and from there it is being used. So you don't have any manual cement bag shifting unless it is a very small job or a domestic work. But cement bags are handling for a large industrial application. Cement bag have almost gone out, except some few small activities. 99% it will be in the silos, it will come in container, and it will be directly pumped with the pneumatic arrangement. So I think, but then still in smaller projects, this is being done. And some other construction material, like for example, rebar and other equipment, hammer, etc., people have to carry. So it is very important that the musculoskeletal disorder is properly understood. Material lifting, shifting, drilling, grinding. Many times this manual work are happening in awkward posture because of the dynamic nature of the job, dynamic nature of the equipment. For example, drilling. For example, grinding. I'm talking about structural in steel drilling, steel grinding. So these are all people have to carry the load, carry the equipment, and do the thing, and that can. So we can do the job rotation. We can do training and awareness, because by training and all, they will know which posture should be avoided, in which posture which aid can be available, and then they can go for it. So that's very important. Now, we can also talk about the loss of hearing loss because of high exposure to high level of noise for a continuous, for a continual duration, as also the loud noise on an intermittent way, like drilling and things. I mean, there are, the grinding, sort of many other mechanical processes. You will have grinding, drilling, and all. You will have the lot of noise. So it is very important that this the 15th most serious health problem is given the importance it deserves, because what happened, it can cause a lot of mental stress as well because of the high level of noise. Now, what should be done? It should be, the equipment can be changed or modified so that the noise generation is less as a part of element. At the hierarchy control, you are trying to reduce or eliminate or substitute. If you cannot do that, then it is important to have other measures, like have take into isolated area, put some sound barrier, have periodical maintenance so that noise generation is less, and at the last but not the least, use the ear muff or earplug. Okay. And heat stress now in various countries, we are now facing the time has come. Now the temperature is going nearly 40 degrees, and in a few days it might become further up. So people have to take care about the core body temperature, which should not exceed 37%. So a lot of water, should be taken. Ventilation should be good. Humidity control, if possible, should be there. People have to have air conditioning wherever can be provided for the resting time and all. There could be some acclimatization window. People do not go from very hot location to very cold location. Cold means in the way, suppose you have AC room which is 22 degree, 23 degree, but then somebody comes from 40 degree, 42 degree and directly enters, you will have problems. So we have to take care of those, gradually making them comfortable and giving the other facilities like so that they have a lot of water drinking, a lot of water to drink, availability, the wholesomeness, the goodness of the water. Because if the water is not good, people will drink minimum. So if the water is good, moderately cold, so people will be, that will to a great extent help to mitigate the heat stress. And enough. And I've talked about a bit about mental health at the beginning. There are physical and psychosocial stressors. Physical stress we all know because of the hard work, the exposure to noise, lighting, the ergonomic problems. These are all there. And the psycho, of course, there are mental pressure, targets. You have to complete within this time. And sometimes work design, the individual may not have much control over the way work can be done. They may know a better method, but people may not ask them, and they may be doing a very awkward method recommended or forced upon by the supervisor or the engineer, and they feel very stressed. Same thing happened with the engineer supervisor if the manager is doing something like that. So, and then it has become we all know about the public health issues. So it leads to the multiple problems like sleep disruptions, and absenteeism and things like that. So it's very important that we take care of the stress and mental health being at construction projects. We should provide the opportunity to the workers to have the, design the work to some extent, distribute the work in a way, go a little early if they have completed the job, and then encouraging them to report in case they are feeling stressed. The manager should be more, positive and give them the solutions. Having the right breaks at right time, morning some exercise, and things like that. And of course, recognizing the people who are doing good jobs. Now, technology. In next few minutes, I will quickly talk about some technological, things which may be of interest to some of you. That is the, like data, the data control, detecting of faults. These are all possible by smart wearables and safe communication, hands-free communication. These are all available now. So fatigue detection, micro slip prevention. The helmets are equipped with all this technological element. So somebody is getting too much of fatigue, if he is feeling sleepy, or is coming very close to some electrical line or power line, or some object while going up by MEWP. Those are all possible. And then also have smart vest, which will have heat tracking, gas detection, and access control. Now, if you see the AI-based technologies, now we have started implementing it for last 2.5 years. Image analytics and predictive analysis is by seeing the software is trained. So if someone is not wearing helmet or some other requirements, it can catch, it can tell the person, supervisor, and create an alarm. And we are thinking of much more smarter technology to replace the manual surveillance and also the virtual reality, so that the real-time simulation of unsafe conditions, so that people can understand what can happen to him. Very immersive, modules can be developed for various skilled people. Somebody falls from height, somebody do not wear the harness, what will happen? He'll fall from height. So he can visualize and take proper precautions for various hazards, health and safety hazards. And of course, for ergonomic problems, which is a very large problem but not much recognized, it has not come to a great extent, I must acknowledge, but exoskeletons are coming. So it will help people to do repetitive jobs, drilling, grinding, bending again and again, lifting, putting the things on the place, giving the brick or putting the, overhead things. So those are the things will be helpful to them. The person will not feel the, pain on the back or pain on the arms, another joint. So these are all going to be more and more helpful in the industry as we go forward. So finally, if we come to the end with this slide, the construction industry is basically hazardous. We all know about it. It has more illness, more injuries than other industries, if you compare engineering industry also. Then you see MSD is one of the major issues. And, it is important that the government and all stakeholders, the owners, the unions, if they are available, and the worker, bodies, other bodies, and worker individually. Sometimes there are workers who are self-employed, should be more and more involved in the process of risk identification on safety and health risk and become a part of the solution. So in a large organization, it's important to have the leadership, have the right timely risk mitigation. If it is delayed, then it can be a problem. Then workplace conditions, and of course, optimizing the working hours, because there is another major area which I have started with. And it is important to have a decent work conditions, to have more productivity and right time of completion of the job as well. So with this, I go back to the chair. If there's any question, if I have taken a little more time or on time, if there is a time for question, or if there is any question, I will be glad to respond to this.
Thank you, Dr. Krishna.
Over to you. Thank you.
Thank you. It was good.
For the opportunity.
In the interest of time, Dr. Krishna, I have some questions. They are coming to me in different forms. Okay. The first question, Dr. Krishna, how can construction companies improve safety culture among employees at all levels with high turnover rate?
Yeah, very practical question. And I must tell, we all are trying to find answer, because you see the workers, workers are going. But once we invest on the workers, they will somehow be back. Maybe he will be back after 1 year or after 6 months. So it is the leadership which has to invest time again and again and continually do it for long time. So once we do that, we will have a transformation in the construction industry, maybe over a period of 3 years or 5 years time. Because you do it today, and then he goes back to some other company, or he goes back to but he will remember. Once he come back, he will get. So I think it is possible if we are committed, if the leadership is committed, if we all professionals are committed. It will take some time, but the population will not get vanished. They will be here, and they will come back. So your investment will not get wasted.
Okay. All right. Thanks for that. There's one last one. This is about confined space. What do you recommend as a medical examination for workers before they start their work in confined space?
Exactly. Very good question. Actually, maybe a physician will be better equipped, but as an engineer, or as a safety and health professional, we first want to see that the person is fit. He is able to come out quickly. He is able to move fast. He do not have some pre-existing illness. Because if he has some sort of asthma and things like that, he may be more vulnerable to some sort of adverse conditions. He'll be more susceptible. So his physical fitness and his age should be also within limit. Maybe I will not recommend somebody more than 50 to, unless it is unavoidable, and maybe more precautions have to be taken. A younger person with a better fitness, mobility, and all parameters being good should be recommended as far as physical fitness is concerned. He should be able to quickly, he should not have any disability in terms of or deformity, and he should be, from other medical parameters, he should be fit, more fit than some, normal worker who are on the open. So I think he should be able to respond to any sort of emergency in case in a more, effective manner.
Okay. So you mean to say that the occupational physician should be come into this picture to do the medical examination, right?
Yeah, definitely.
All right. Okay, with that, thank you very much, Dr. Krishna. Thanks for being with us and for the time you spent. And let's move on to next presentation.
Thank you for the opportunity. Thank you. Yeah.
See you in the Congress.
Thank you. Yeah, sure.
Okay, let's go to our third presentation. All those hazards and risks which were mentioned by the earlier presenters can eventually lead to one big problem, that is stress. Unlike other occupational diseases, work-related stress is not easy to be identified, assessed, and managed. A lot of time and resources are needed to handle this situation. So today, Dr. Adi Mutiara, an occupational medicine specialist from Jakarta, will share her experience in tackling occupational stress. Dr. Adi is also the Secretary for Scientific Committee on Occupational Medicine, SCOM, ICO. So, Dr. Adi, you are here. The screen is yours.
Thank you, Dr. Gogilan. Hello, everybody. Good afternoon. I think I'm like 1 hour behind you, but still the same zone. Thank you for the opportunity for me to share about the work-related stress. I believe that every one of us work and stress is part of us. So before I go to my presentation, let me share a quiz for you to fill. So first, please, can you see my screen?
Yes.
You can load to your phone or your laptop. Go to menti.com. and enter the code 8503 6832, and there's one question over there. So I want to see how far do you know about occupational stress. So I will give you time, like 3 or 5 minutes, to fill what you know about occupational stress. Any answer that you gave me, it will be shown in this screen. So the code of the www.menti.com, and then fill the code of 8502 803 6832.
Adi, we need to have this Mentimeter, is it?
Yeah, I wanna, trace you to the occupational origin. I think that's a good answer. One answer come in. I see more than 30, almost 40 people. Work-related stress to the body and mind, stress arising from the workplace. Okay, that's all good answer. Okay. 2 more minutes. Stress from the workplace. Okay. Eleven response, work overload. Yeah, that's work overload. Okay, that's the cause. Good answer. All good. I think Dr. Gogi, everybody already know the base that actually the occupational stress comes from the workplace. And I'm happy that everybody is still active at this hour, right? Not enough money. Okay. I think you have to talk to your boss about that. Emotional distress caused by workload, feeling stress because of work related. Okay. Okay. That's all a good answer. I think everybody knows that actually occupational stress is really stress that comes from the work. Okay, I will go now to my material, but so far as a basic, you all already know that the occupational stress, actually the stress that comes from the workplace. Well, so thank you for keeping with me at this hour. So I will discuss and we actually just share about occupational stress, how to deal with it. So I'm Ade Mutiara. I'm the secretary of the Scientific Committee of Occupational Medicine from ICO. I come from Indonesia and I live in Jakarta. Yes. Okay, so today I will talk about more about about occupational stress, the resource of occupational stress. How do you know that you have occupational health stress, and how do you deal with it? And then why the company should have mental health program also at the end of for sure that we'll talk about the summary of this discussion for today. As a disclosure, I have the conflict of interest in doing this, so I'm really happy to be invited. It's an honor. About occupational stress. So the stress itself, as we know, is a mental condition in the form of mental pressure and anxiety due to problem in life, work. So anything that we face in life can cause as a stress. Something that cause feeling of depressed or anxiety and response to the situation or condition that can affect normal human function. So the cause of the stressor actually is the how we live it. I mean, we wake up every day. We always face any stress. Now, how we respond to that? If it's a positive response, we call it eustress. But if it's more than what we can accept, we call it distress. So actually, the stress itself is good for us to make we move to make us walking in our daily life to move forward to challenge ourselves how to face this kind of stress. And then how the stress occurs actually in the part before you said that is overload. So in our daily life about the needs of the environment, the needs of the family, the needs of the work, there's a pressure. There's internal and external demand from our boss, from our peers, from our family, and we have our capacity from our knowledge as a skill, so many things, like the financial skill, like the soft skill. It's a balance between the needs and the capacity, and then from these two, we will respond to that needs. We can respond emotional, behavioral, or physical. If the needs is the pressure is too heavy, sometimes our physical also will respond, like the headache, like sometimes you feel nauseous every time if everyone you see your boss, or let's say you not finish your job, and then you have to face the deadline. Your physical start to respond. It's also emotional. You don't want to see anybody if you're on a deadline, something like that. So we can each person can be a fighter or can be a fighters. So on the flight they can give away, retreat, discard for the fight, for sure that you can stand on your ground, defend your position, attack, or preserve. And what is occupational stress? Based on WHO, this occupational stress is the response of people may have when presented with work demands and pressure that are not matched to their knowledge and abilities and which challenge their ability to cope. So actually, there are source in the workplace between demand, and it's not matched with your skill and in your abilities to face that demands. Based on the HSE in UK, it defines that at first reaction, people have to excessive pressure or the other types of demand placed to them. So the worker feels stressed that they cannot cope with the pressure on other issues. And what is the source of the occupational stress itself in the workplace? So for sure that the pressure at work is unavoidable in daily basis. So the stress itself can be so dynamic. Sometimes today that everything's like cool like a breeze, but another day so many things on your plate. So that's why the pressure is always there. Now, how you face that? It is unavoidable to the demands of the contemporary work environment. Pressure perceived as acceptable by individual make even keep work alert, motivated, able to work and learn, depending on the available resource and personal characteristic. And personal character itself also influenced by so many things. How you raise in their family, how your family raise you, whether they keep challenging you or they spoiled you. It really can form you as a personal character, how you can face the stress in the workplace. The six main areas of work designs that can be the source of the stress. First, job demands. So people can be stressed if they're not able to cope with the demands of their job. That's why on the pre-employment test, they really test how your personality, how your skill, how your capability can fit the demand of the job. Sometimes along the way, when boss, if you have the supervisor that gives you more than what is on the job description, you feel like the demand is too much for you. And also how you control if the employee are unable to control the way they do at that work. So you don't have the time management, the priority, everything's sometimes it's not right in the control issues. And also the support. If the employee doesn't receive enough information and support from their peer, from their supervisor, and also actually the family support take important factors. If you have a fight in the house and with your partner, with your spouse, sometimes people can just ignore that and then still do it professional. Sometimes they bring their feeling of uncomfortable feeling to the work, and also they will influence their productivity. And also um, the relationship in the work between your peer, between the supervisors, and then between the other function. And the worker are having problem with the relationship at work or are being bullied or harassment. That's why the company should make a standard, the management, how to deal with the bullied or harassment in the workplace. Also, sometimes people don't fully understand their role and responsibility. The employer should really give clear job description. What is the role and what is the responsibility? That's why the procedure, the role and responsibility should be written in the clear situation. And also the change. The people who is not really good in adapt and adjustment, they will have a problem to find the change, to face the change. Like during the pandemic, it's a very very dynamic. That's why the mental health issues really raise very very high during the pandemic, because in it really changed our lives. For some people who's not good in adaptation, they start to have the anxiety or the depression during the pandemic issues. So they are not engaged when the business undergoing the change. And then now, the work-related stress can be caused by poor work organization. So, for the small companies that one person can do so many multitasking, as long as the information is good between supervisor and the subordinate, it would be good. But sometimes if the small is a small organization, you just do anything without any clear instruction, it can give you the work-related stress. And the way they design the work system and the way they manage them. Also, the work design, like a lack of control over work process. Also, the unfair treatment with the supervisor, the gold child, gold workers, like the poor management, unsatisfactory working condition, and also lack of support from colleagues and supervisor. It's really, really important that you should feel accepted. You should feel appreciated at the workplace. You should feel that you contributed. Sometimes you do enough, but there's no appreciation, and also there's no recognition. I think it's very human that you need the recognition from the workplace, either from your peer or your. That's why the KPI, the clear KPI, and then you can really assess the performance. Really, the recognition is important to each worker. Now, how do you recognize the occupational stress? For sure that there is a sign that the worker can have occupational stress. The signs of the stress in a team include so many arguments along, there's no solution. The higher staff turnover, more report of stress, like some friends said that she cannot work optimal because she's in stress, like more sickness, absence, decreased performance, and more complaints and grievance. And the signs of the stress of worker itself, that a change in a way someone acts can be a sign of stress. For example, they take more time off, like from 8 working hours. Sometimes they only work for 4 hours. The next 2, they just sit outside smoking, thinking about like and daydreaming, or they just talk too much in the pantry or outside the lunch break, arrive for work later, or be touchy or nervous every time they got assignment. So in the change of way of some of things or feels can also be a sign of stress. For example, mood swings, like in Indonesia, there's like a wording like senggol bacok. You touch them and then you just slap your friends, something like that. So it's like the slang of the Indonesian word. Like being withdrawn, you don't want to talk to your friends. You're isolated in your own cubicle or your own room, and loss of motivation, commitment, and confidence, and also the increased emotion reaction, being tearful, sensitive, aggressive. So once you find that your workmate has this kind of sign, maybe you can start to report to your supervisor or try to find some help. And now, how to deal with it? For sure, it has to be from both sides. From the employer itself, we have to assess the risk of work-related stress in the workplace and take action to protect the workers. Because you could review policies of bullying, harassment, and discrimination, and check whether there's a first aid needs assessment, consider physical and mental health needs. So the first aid is not only for physical, not only for heart attack, not for the burn case, but first aid and the psychology also being needed. There's like a training for a first mental health first aider in between the peers. So once the peer see the signs of the earlier of mental health issues, and then they will give you the ventilation. There's like some theory of the first aider for the psychological emergencies. Also, the work itself, so they can help look after their own stress level at work. If you think you have problem, talk to your manager or colleague or your GP or your company doctors. And if you have employee assistance program, is the comprehensive mental health program for the mental risk assessment until the mental health illness treatment. So you can use the third party to do the EAP. Some big companies use the EAP to help a company in dealing with the mental health program. I'm sorry that I still put some bahasa over here. If how do you deal with the work, with the occupational health threat? For sure that physical and mental is really like yin and yang. You have to you cannot be called you're healthy if you're only physically healthy, but you have a mental health issues. So it has come to both. By having a good physical health, it will really make your mental performance a boost. Like if you're exercise, if you're doing good exercise, good nutrition, good sleep, really help your mental health. And also make sure that you educate your peer about doing a healthy lifestyle. So, and sometimes you also need a time off from your gadget. Sometimes the gadget really can make you more stressed because you compare yourself with others, or you just have to meditate and then avoid the hoax and any other issues that can give you more anxiety. And also protect yourself and your closest friend or your closest family, and try to learn to how to think positive. So I got it from my peer, a psychologist in the workplace, that life is about marathon. To finish a marathon, you need the endurance. So make sure that you're not running very fast in the first, but make yourself in the good pace in daily basis. Just take your time, take your breathe. If there's so many things on your plate, do the prioritization and make sure that one thing at a time. Don't think that you can finish everything in one day. Never, just do at your own pace and never give up and keep trying. So we have to acknowledge ourselves. We have to appreciate every small steps that we made in the workplace. So keep active. So do your exercise. I I myself really cope with my stress during the pandemic until now by doing the 30 minutes exercise regularly, because it will clear up your mind. The oxygen come to your brain very fast, and then you can think clearer. You can be more productive. So I do really recommend you to do the regular exercise and also good sleep to make your mental health response to any stress that you face. And also, there's like we call it self care, based on the Maslow hierarchy needs. On the very basic psychological needs, you have to live your healthy lifestyle. For the safety needs, make sure that emotion control the negative thought, more being positive, and also your belongings, intimate relationship with your family, with your friends, you'll have to maintain, because social is also part of the health of the human being. So in the WHO definition of health is physical, mental, and social. So make sure that you have friends, you have a good relationship with the family. It will also will help to face anything at the workplace. And also the esteem needs, work minus spiritual. You have to be aware with your self potential and limitation. Uh, what the limit that you can deal, and talk to your supervisor about the load of the demand of the work. And also that with a good adaptation, you will be more flexible, and then your life will be more bermakna, means meaningful to me, that you can find the full potential in your workplace. So in the workplace itself, for sure that I am occupational medicine doctor and also Dr. Gogilan. We are in the working occupational medicine thing, and then we have to have a mental health program in the workplace. What it is, so for sure that we have to do the stress risk assessment to the employees. How can you can do like a regularly. The company can help you identify potential risks to your workers from from stress, and then to take action to protect the workers. And also you could review policies of bullying, harassment, also discrimination, and check the first aid needs. Assessment consider physical and mental health needs. So the mental health screening tools, in our practice in the industry that I work in, oil and gas industry. So mental health checklist also part of annual medical checkup. So although it's only one shot, but you can find out the status of the current mental health of the employees, and then you can profile how regularly check again with the tools, the mental health tools that company can provide to the employees. So there are so many health questionnaires like self-reporting questionnaires for the general mental health, also the general anxiety disorder identification, and also for the depression with the personal health questionnaire that it depends on what you need in the workplace. So it's important that the company should really do regularly survey to the satisfaction to the mental health for the on the workers. And also as a summary, to make sure that is the procedure of mental health procedure in place. Like to make sure there's a commitment for the management from the management that mental health is really important issues to make sure that the productivity that the people is number one. Also assess the risk of the resource of the stress, about the job demanding, about the support. Do you have any like focus group discussion, or is there any peer first aid for the mental health? Also spotting the sign of the stress between the peers and help the workers. Support the wellness program by living a healthy lifestyle. Also promote the healthy mental, physical good lifestyle. Really will help the overall well-being of the workers. I think that's all I can share by today. I hope it will be useful. So I'm open for any question. Thank you.
Okay. Adi, can you hear me? Adi, can you hear me?
Very small, Dr. Gogi.
Can you hear me now? Better?
Yes, I can hear you now.
All right. Sorry, because it's very heavy rain here, and the noise is a hazard for us now.
Oh, I see.
Okay,
Okay,
Adi,
sure.
there are a few questions on the occupational stress. Just give me a minute. All right, the first question. Stress for some can be seen as positive stress for improvement. How do we evaluate worker in terms of capability of handling the stress in order for us to come up with fair risk assessment, given that the mental resilient capability is different across workers? I mean, you got it? You want me to repeat?
Yes. Okay. Okay. Thank you. Very good questions. Yes, the capability of the resilience. That's why the mental health program in the workplace should define the survey of the company, the regular. So if the resilience has to be promoted, have to be educated. So the communication, the assessment of the each employee's resilience can be done during the annual medical checkup. And on capability and there's like I don't know what do you do the like the IQ tests for during the pre-employment about the motivation, how you deal with the stress is part of the test for the pre-employment test, and also regularly check before the promotion is part of the test that you have to do before promoting a worker to make sure that you can deal with the bigger demand, with the bigger challenge. So there's always the mental health check before moving workers from one place to another, as part of not only fit to work as a physical but also mental health by the psychological test.
Okay. All right. You know what? Stress is always a very favorite topic, and I'm getting a lot of questions coming from the participants here. There's one question. How do you recommend workers for RTW, return to work program, for someone who had PTSD, post traumatic
Okay.
stress disorder, for them to return to work?
Okay. So PTSD actually is already a diagnosis for the mental illness, whether it's mild or whether it's mild or it's severe. So I think once it's already an illness, because it's a post-traumatic, PTSD is one of the diagnosis of the psychological issues. So it means that it will be already need help. So the company doctor or any HR should refer the workers to see the the professional to help to deal with that, so they can still be productive, because it's already a diagnosis of the mental disease. Yeah.
Okay. Thanks, Hadi. Next one. How can we set a good mental health culture, stress-free environment, okay, in a highly stressed worker environment such as healthcare worker?
Okay. I think a stress-free workplace is, I can say it's impossible, right? So we, since pandemic, we really, especially for the healthcare worker, uh, the statistic really shows there's an increase of depression and anxiety between amongst the healthcare workers. So I believe that the in every country, the high number of anxiety and depression has become higher, especially amongst the healthcare workers. And to what we have to do is to increase the resilience capability, the resilience skill, how to deal with that, how to make the job unavoidable job load, with the, let's say, rotate. It's the same with the administrative elimination, and also the APD, the PPE, the right PPE really can reduce the anxiety. Once you feel that you're secure from the health hazard, for sure that you will feel a bit safer, compared to. But for sure that education, ventilation, regularly discussion amongst them really can help to deal with the stress amongst healthcare workers. But to make stress free, I don't think we can do that.
Yeah, agreed.
Yeah.
Right. The next question is from Dr. Ahmad Fairoz. What is the psychological risk assessment tool or questionnaire that you use and practice?
Okay, if I'm talking about Indonesian practice, under the health ministry, for the really simple SRQ20, we already validate in our Bahasa too, just to make a regular generals, because all the 20 questions is all about the physical symptoms, whether you have a headache, whether you want to be angry every day. So it's like one shot capture, whether you so it's about scoring. I want to show you something. I There's like a calculator. Wait. uh, for the SRQ itself, it's only for general questionnaire, but for this there's a website. Can you see my slides?
Yes, yes.
Okay, so this is a scoring. This is the like calculator. You can make your own system in your company. One of the company in oil and gas, they gave this questionnaire in weekly basis, just to check whether their workers is in their depression or anxiety. But for the general, the PHQ you is the second step after you find out the score of the SRQ20, give a sign that they have this depression, and then they will go to this PHQ for the depression. So there are so many calculators of the mental health screening, but the tools, if you ask what kind of tools that we use for the general mental health check, we use the SRQ-20 because it's very general, and then you can once you find out there's like a mild stress or the severe stress, you can go further whether they have anxiety or depression or like a PTSD, something like that, because all this it will help to find out the company to see the profile, how, let's say, at the end of the year, once the budget or the reporting, the stress level of the employee is getting higher compared to the first quarter of annual. That's why you have to do. Finally, you can see the pattern of the mental health profile of your workers. That's. I hope that will answer your question, Doc.
Yeah, thanks, Adi. Dr. Adi, there's one more. As an occupational physician, do you advise for prolonged sickness absenteeisms due to stress from work? I mean, this is an occupational stress from work. So do you advise on prolonged sickness absenteeisms? Means away from work, or you ask them to come back as soon as possible. So what is your take on this?
So far, during my experience, I don't have any experience in giving prolonged sickness from mental health issues unless they already diagnosed with the mental health illness like schizophrenia or depression. Yes, we give them, but until it's a prolonged, I haven't had an experience yet, except the physical from stroke and everything. I also haven't identified any clear regulation for that prolonged sickness for the mental issues. And it's treated the same with a physical long sickness, as long as the professional gave them the sickness letter and then discuss with us as a company doctor. Once it our regulation, it only allowed until a year. After a year, yeah, we have to evaluate is there any possibilities that they can be back to work as a return to work evaluation. If it's said that it's already, and then we will prepare the termination due to the medical issues.
Okay, so it's all based on that. All right, can I ask you the last one? There's one last question. Okay.
Yes.
Most of the mental health tool focus on self-assessment that is perceived by the employee. How can employer tackle psychologically this psychological hazard and occupational stress as the same as far as we conduct hierarchy? I mean, you understand what was the what you
Yes,
you know what is hierarchy, right?
Yes, that's a good question, a very good question, actually. From based on because psychological issues actually is about the reception from the workers. That's why most of the mental health questionnaire based on the self-reporting. Although it's let's say, and it's really individual. That's why the company have to really see the capability, the resilience level of the workers to face the psychological exposure in the workplace. And how to measure the psychological exposure in the workplace? Again, I think it's based on the capability of the workers. Let's say I would share with my own experience as an oil and gas company. We have the offshore workers. I think Malaysia also has a lot of oil and gas companies. Rotation worker, office worker. There are mental health issues, basically the same, but they're like for the high, like working at height. We have to check the mental health issues because if they, for sure that we cannot send the people with the hygrophobia to the working height. It's part of psychological factor. But if there's no problem with the height, so that's why it depends on the capability of the workers. But yes, psychological issues always based on the perceived the workers. So we cannot accept spoiled workers to send to the offshore and out of their family if they in the daily, since they already got the support from their family. We have to find a tough person to work in the rotation basis. So yes, I think we have to accept that the occupational stress psychological exposure has to be assessed based on the workers perceived. That's why we have to educate to increase the capability, increase the adaptation, increase the resilience, to make sure to lower the risk of psychological effect to them. I remember I have one case in the Papua. It's very far from Jakarta. A week before the workers go to rotation, his kids already cried, and that day that he has to leave, the kid doesn't want to always hold their father's leg. Not so every time, every day, finally he cannot perform the work because every time he called the home, the kids cried every single day. That's why finally the psychological has to also cure the family, educate the family, not only the workers, because the family problem also, and it's part of psychological issues that we have to face from the workers perceived. From other work is okay, but for this particular workers is a problem. I think it's really based on the assessment of the workers profile.
Okay, I think there's one last one, Adi. Okay, before we wrap it up, from Dr. Ahmad Fairoz, what is the occupational mental health risk assessment that you are practicing? I think you have answered this, right? That is earlier was on a psychological risk assessment. This is on the occupational mental health risk assessment. Are their answers are the same?
I'm sorry. What is the question again?
What is the occupational mental health risk assessment that you practice?
I think I already answered
Yeah.
that about
So
the
that was
SRQ,
the earlier question
20,
was,
and then yeah.
yeah, the earlier question, Adi, was the psychological risk assessment. So now is the occupational mental health. Is there any difference? Is there any different tools for both of them?
For what we do actually is the same. It's like with the regular check risk assessment. Yes, risk assessment is part of the hierarchy, but Dr. Fatima Azhara. So we put in the document what is the psychological factor that can potentially cause the stress to the workers. But the assessment of the questionnaire tools that is perceived by the workers is that's the questionnaires that I explained before. But the psychological risk assessment tools, there's a lot of psychological risk assessment tools that from WHO, from UK. I will send it later if you need, because there are so many assessment tools for the risk assessment psychologically. But for the questionnaire, it's more on like you said, it's more on the workers perceived, what they feel about the work place. Yeah.
Okay, Adi. I think thank you so much. As I said earlier, stress has always been a favorite subject, a topic for everyone, and that's why you have endless questions coming in. So anyway, thank you very much, Adi. So, dear participants, we have come to end of our webinar, and today we have discussed many important related matters related to safety and health and workplace. The workforce constitutes a significant part of the population. With an aging population now, we can expect that there will be increasing number of health issues to be addressed among older working people. Hence, involvement of top management to the ground staff is vital in any organization. With that, thank you speakers, thank you participants. I would like to hand over the screen to Professor Dr. Siti Munira Binti Yassin, the Director for National Occupational Disease Prevention, NOPID, Program UITM, for the closing ceremony. Prof.
Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to all. Thank you so much, Dr. Gigilan, for the wonderful moderating the international session. And thank you so much to all our international speakers, Dr. Tongai, Dr. Krishna, Dr. Adi, for being with us until the end of the session. So I think we have come to an end, ladies and gentlemen. Okay, so at the end of our International Occupational Safety and Health Day, I want to express my deepest gratitude to each one and every one of you for your participation, your insights, your dedication to advancing workplace safety worldwide. Throughout our time together, we have explored great knowledge shared by our local and international speakers, shared innovative strategies, and engaged in meaningful discussions aimed at fostering safer and healthier work environment for all. Your passion and commitment to this crucial cause are truly inspiring. As we depart from this gathering, let's carry forward the knowledge gained and connections made, and the collective determination to continue our efforts in promoting occupational safety and health. Together, we have the power to effect positive change and create workplaces where every individual can thrive. I encourage you all to remain vigilant, to advocate tirelessly, and to never waver in our shared mission to ensure that every worker returns home safely at the end of each day. My special gratitude to our collaborators, DOSH, SCOM, ICO, not to forget my wonderful committee members of this program from the Faculty of Medicine, UITM Shah Alam, Corporate Com, and IT, and Faculty of Dentistry, and of course, Faculty of Health Science, and lastly to all the NODIP staff and consultants from within UITM and outside UITM, like Indah Water Consortium, for your wonderful support throughout the event. To all, thank you once again for your unwavering dedication. Let's continue to work hard in hand towards a future where workplace safety is not just a goal, but a universal reality. Safe travel to all, and until we meet again in the future, inshallah. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Alhamdulillah, our program for today has come to an end. But before that, UITM would like to express the highest appreciation and thanks for the participant and cooperation of all program participants present today. May all the information and guidance shared be practiced and implemented in your workplace. The organizers would like to remind all attendees to complete the post-program questionnaire for afternoon session by scanning the QR code in the file provided, or through the screen for digital certificate issuance purposes. For your kind information, we have a lot of information that for morning sessions, a lot of people doesn't do the pre and post questionnaire. So please fill in. We have some refreshments at level 1 before leaving this program. On behalf of the program committee, I will apologize for any shortcomings during the event. Thank you, and selamat Hari Raya Aidilfitri. Thank you so much.